My name is Dr. Stephen Merrell, and I practice family medicine here in Farmington, Utah. We are very grateful to collaborate with Success with Breastfeeding, very highly credentialed, very experienced women who work with lactation. I'd like to talk about the importance of early intervention. Though it's described as intervention, it's actually probably better termed early natural breastfeeding. Breastfeeding is not always easy to do, even though we've been doing it for thousands of years. And the sooner we can get qualified individuals helping that process happening, the more likely it is to be successful. I can share a little bit of our own personal experience with my wife and I. We have 3 kids, and the first 2 really struggled with breastfeeding, and it can be emotionally and physically taxing. On our 3rd child, we actually connected with Success with Breastfeeding before our son was born, and it was frankly smooth sailing through the entire process, and it was the best experience that we had had with breastfeeding. As somebody who is a huge proponent of breastfeeding, we try to start that within the first hour. I'm one of the physicians who will actually help that process happen during what we call the sacred hour, which is the first hour of life for that baby. After a vaginal delivery or a C-section, we're trying to get that baby to the breast with a good latch and starting to pull colostrum down, starting to bond with mama from the outside. Almost every single patient, if not every single patient, I recommend sitting down with our lactation consultants, because if we can get them in with making sure that milk production is good, the latch is good, baby's suck is good, then I don't have to worry as much in 2 weeks or in a week or in 6 weeks when weight has become an issue and maybe the latch wasn't as good as we thought, and now we have a baby who is struggling, and it didn't have to be that way. So as soon as we can, we try to connect our patients who are interested in wanting to breastfeed with our lactation consultants, because it works. Every single patient I have sent them, and this is not an exaggeration, has benefited and done so much better, if not continue to breastfeed for months and months, as long as they would like to. And I just can't emphasize enough, the sooner that is, the better. The body, once mom is delivered, is supposed to receive those signals that breastfeeding is occurring. And when it is, and when those signals are received and heard, then the body can respond, and we can help women breastfeed and feel successful in that. If you desire to breastfeed, if you're currently pregnant, anticipating pregnant, or have breastfeeding in your future, please make an appointment. We would love to discuss how Success with Breastfeeding can be successful for you prior to even the delivery, and then definitely after delivery and thereafter. So please reach out.